E- Good evening, everyone. Good evening, Heleen. Thank you for joining us tonight. We're just going to give it one more minute because we see quite a few. The attendees are jumping on. Let me give it a minute before we start. Cool. Only coming. Let's just give it one more minute and then we'll kick things off. All right. Okay, I see lots of people online and I am conscious of time, so we will get cracking. Good evening, everyone, and thank you for taking the time in your very busy lives and schedules to join us online tonight. I have bribed my children to keep quiet, but if they do barge in at some point in this webinar, I apologize. We're very excited to share with you what we've been working on in the world of clinical AI. We want to keep it short, punchy, frankly, not salesy, really just to leave you excited about what AI can mean for you and your practice. A quick bit of housekeeping. We will leave some time for questions. If you have any questions during the webinar, please just type them out and send them through. Helene and Matt in the background will check the questions and prompt me. We'll try to answer as many as possible. This will be recorded and shared with you. So if there's anything that I go a little bit too quickly on, you'll be able to watch it again. While we're here, we have a core belief at Healthbridge that innovation must always serve the clinician. That's why we've embraced with cutting edge AI tools or embraced cutting AI tools, not for AI's sake, but really to support you in your practice. Our goal is simple: develop a solution that acts as a genuine ally to you in your practice. We want to actively support you in your process and how you treat your patients. And that's, our product promise really is to make AI your ally. And hence the name, our AI powered clinical assistant. I'm Jared, the head of product at Healthbridge. I've been at Healthbridge for over 20 years. I did leave for a few years, but my passion for healthcare pulled me back in. I'm joined by Heleen. Heleen, do you want to introduce yourself?
Jared, thank you very much. I'm Heleen Fengler, and I am the product owner of Healthbridge Clinical that we are going to look at tonight. Very excited. Um, at Healthbridge, we also have something called the boomerang effect, and I also left and came back. Um,
Yeah.
so yeah, Jared, back to
So
you.
we both boomerangs, both boomerangs. Awesome. I've also asked Helene to be my timekeeper. We're going to keep this to half an hour, and as I mentioned, a few minutes at the end for questions. She will keep me on point. She actually is the product expert, so I get to show off the awesome work of the product that her and her team are building. And Helene, just if there's any key ideas, key points you want me to double click on, please just chime in. Okay. I am not going to do a long PowerPoint presentation, which I think you'll all be pleased about. I'm going to share my screen and get straight into a demo. I promise to keep it punchy, so let's do that. Helene, let me know, can you see Healthbridge Clinical?
Screen is loading up. I will confirm.
Oh, my screen sharing is paused. And let me click resume. Hold on, but it's only showing the one
Wait,
screen. Okay, let's try that again. And we did a dry run before this and it worked perfectly, of course. Okay, there we go.
always fun in the world of demos, Jared. There we
Yes,
go.
of
Now I can see
course.
your calendar
Okay,
screen.
brilliant. Okay, let me just make this a bit bigger. So what you're seeing here is Healthbridge Clinical. I know normally we do quite an extensive demo. I'm gonna just do a quick orientation for you. This is our clinical product, our EMR. It is separate to the practice management software. So this is really as a clinician where you come in and work every day. You will have a view of your calendar. This is an integration that can be done via online tools that integrate with Google Calendar. It can be also via Recomed. So there's a few ways for patients to book into the calendar, or they can phone your practice and your admin person can book it in on the admin side, which you can see here, Healthbridge Nova, and you as the clinician have a sense of your day and also who's in the waiting room waiting for you. We have our clinical files at the top, and I'm going to just jump straight into, let's actually go to Profesh as an example. The idea here, we are not doctors. We worked with doctors that helped us build out the file and what it should look like. Let me zoom in a little bit. So we can see Pravesh, he's a passionate supporter of South African Proteas. He's a Man United fan. Unfortunately for him, he used to play recreational cricket. He is a diabetic type 2. He's on metformin. He's compliant. He's got hypertension. Can see what medicine he's on. Uh, he's actually got quite a few different chronic conditions, surgical history, lifestyle, and this is all very simple to capture, very easy to generate this content, but it's great as a clinician that you can open the file up and it's everything that you would have typically seen on a paper file, but is now digitized for you. And we've had this for a few years, but really where AI comes in, if you look at Pravesh's file as I scroll down, he has a long history. He was here on the 17th. There's obviously a bogus patient we use for demos, but you can imagine over time just a very rich clinical history, pathology results, lots of comprehensive notes. And this is quite a tricky patient, lots of conditions. So now where AI can assist you here, and I click on the side and you pull up the clinical assistant. There's a few different things this can do. You can generate different documents. You can generate a visit summary, a motivation letter. You can get some clinical insights on this patient, which I'll do now as an example. Before Pravesh walks in, I'll say, what should I be aware of for this patient? Now, what this will do is it'll go look through the entire file of Pravesh, pathology results, past history, clinical notes, chronic conditions, scripts, anything discussed and mentioned. It'll go through. It'll then ask, the AI will say, will ask the question. You'll see it's busy analyzing and it'll start populating now in real time on the screen. This is a very, as I mentioned, complicated patient, as I showed you. So that'll generate here. You can see it's starting to populate and
Jared,
it's
while
left.
the system is thinking,
Mhm.
we also, if you think pathology and it's a cumbersome process, how do I get the information into the system? We are also integrated with 515 of the major labs.
Mhm.
So if you send results to the path labs, it will automatically come into the system and be part of the patient timeline. So you don't even have to lift a finger. It will all there be available. And of course, AI can pick it up and do the smarts for you.
Great. Awesome. Thank you. So already we've got some clinical insights on Pravesh. So the most critical immediate concerns, patient's documentary history of angioneurotic edema, currently prescribed an ACE inhibitor, posing a life-threatening risk. Additionally, he's a type 2 diabetic. It's uncontrolled and even references the HbA1c. So as Heleen mentioned, it's gone through the pathology results on the file, picked out the HbA1c, his hypertension, and significant increase in cardiovascular risk. Low vitamin B level, 12's elevated PSA also warrant urgent attention. So this is the summary that AI has given us. If you want to understand the clinical reasoning, you can click on this and go into a full comprehensive breakdown where it gives you everything from the initial assessment of the patient, differential diagnosis, the evidence evaluation. So really rich if you want to know more. And you can ask anything. You could ask a question, is vitamin supplementation recommended? It'll probably come back and say yes, due to the low vitamin B12. Think of it as ChatGPT for this patient, and it has this patient's context and history and clinical information. So it's extremely rich and powerful. Um, if we go down in Pravesh's history, we'll see he has a lab result from July. This is from Ampath, the integration Helene mentioned. You're all very familiar with the pathology results, of course. You can see here we ordered a lot of tests. I will scroll down. We'll see the GFR is low. HbA1c is very high. Glucose fasting's high. LDL is high. So, there's a lot to get across to this patient should you want to phone and speak to them about their results. This is a brilliant use of AI where you can open the pathology messenger and it'll aggregate all that information and write a message for you to the patient. So it'll say, hi, Prithi, I've reviewed your recent blood test results. I want to walk you through the main points of our plan. The most important finding is your blood sugar levels are very high. HbA1c, it explains what that is, measures your average sugar over the last 3 months is 10.9. Your fasting glucose is also significantly elevated. So the AI has interpreted the result. You can edit it, you can change it, you can update the message if you want, and you can send it directly to the patient on WhatsApp. I do have an example of that. Clinically, we also have the cumulative metrics. So HbA1c is high at 10.9. If I click on this, I can see over time what it has been. So it's been around 7.8, 8.1, 7.9, and now it's 10.9. So things are getting worse. If I scroll down, same, I can look at the PSA. It's at 4, and last time it was at 2.8, and that was a year ago. So this complication of all the data and history, we've worked with doctors. We have 50 doctors that we have on what we call the client lab, and they help us evaluate what we're building just to make sure that we can bring out products that really serve you and help you and speed things up. I love this example personally. So I will show you my own pathology results that I received from my Healthbridge doctor. Um, Here we go. I got this message saying my important update regarding my pathology result. I clicked show message. I was having chest pains. Don't worry, I'm okay. It'll say that my recent results, I just want to explain to you, ran these tests because of your recent chest pain concerns. So it understood the context while I was at the doctor. I'm pleased to tell you that your CRP, your CK, your everything, all levels are within normal range. This is good news, as these tests help to check for inflammation, muscle damage, and any stress on your heart. We can discuss these tests further, and I can respond to the doctor, and he's able to see it inside Healthbridge Clinical. I can also show there's a WhatsApp message for my appointment tonight that I received for this demo as well. I think, Helene, I think I did the pathology AI justice there. Anything I might have missed
I
out?
I definitely think you've done it justice. And what we've heard from providers, and this is verbatim, where doctors said it has saved them anything between 45 to 60 minutes a day because they can craft this message, not even by themselves. It's not just this robot message. It's very human-like written, and it puts the patient at ease. It gives that little bit of sentiment to say, you know what, even if there's something wrong, we will work on this together. But it has radically reduced how they do their admin, and they have time to go and sit and watch their kids' sport games or just have dinner with the family. So yeah, we are truly proud of this.
Awesome. And as I mentioned, you can prompt it just like you would prompt any of your AI tools, reassure patient more. And it'll then go through the message again, recraft it and put it in kinder terms. Understand this news can be concerning, but we have a clear and immediate next step. We'll work closely with the specialist to get you, the best care. So yeah, really, really helpful time saver. On that, so what I've explained here in the flow, patients made a booking, possibly through a Google integration or Recomed. You've gone to the file, we were in Pravesh. You can ask AI what you need to know. You can then look at previous pathology results, and now we go into the consultation. We we have a AI scribe down the right-hand side here. We've partnered with Nora. You can click start recording. It's an ambient scribe you would have seen, possibly Scribe MD or Heidi or Nora. We work with Nora, South African company, and this will listen to your consultation and put it into clinical notes. If I go back to Pravesh's file, I can show you that an example of it. I'll quickly scroll down. Here we go. Chief complaint for gastro, how they presented, objective. It's taken all the information that you might have mentioned in the assessment, the blood pressure, heart rate, and it's transcribed all of this, so there's no typing required. I think you'll see the theme. Let me just go down to there's another format. You can also have it in SOAP. I wonder if this patient's got any SOAP notes. Doesn't look like it. I know Claire does, but you can choose the format that you want the AI scribe to put the information in. Um, Helene, I think I'm not going to do a demo of that because I am conscious we're already 15 minutes in, and I think a lot of the doctors are aware with how ambient listening works, and it's a huge time save. That all this information that comes in, the ambient listening, the pathology results, historical notes, that's where this AI clinical assistant becomes really a rich ally. So if you want to have a visit summary, so I'll click on generate document. I can generate a visit summary for Pravesh. It'll understand any key points. You can also emphasize things if you want, and you can send this via WhatsApp to the patient. So for Pravesh, during the visit, he's currently there for flu, including fever, chills, and body aches. Uh, I discussed taking Gen Pain with him. I got some follow-up instructions, lifestyle modifications. Now let's assume we want to do a custom document. So for Pravesh, I will say reassure Pravesh's wife that we will help manage his chronic conditions. And we are in this as a team together.
While
And
the
we'll
document
generate
is
this. Mhm.
generating, I think when you showed the previous one about the visit summary, a lot of times, and we've heard this directly from doctors, the patient, especially being not newly diagnosed with a chronic condition or you just very severely ill, you don't listen to everything that's being said. So you walk out of there, you have to either phone the doctor or phone the receptionist to find time to get the information. With the visit summary, it's on your WhatsApp. You can go home, you can read it, digest it in your own time. You can give it to your wife or your husband and say, please help me to read and understand this. And you have something to go home with and not just the wonder of what did the doctor actually say?
Yeah. Yeah, exactly, exactly. So, I mean, that's where visit summary is hugely powerful. This is a custom document. You can see what is written here. I'm writing today regarding your husband, Mr. Pravesh, following recent discussions. I understand you may have concerns about his ongoing management of his chronic health conditions. It'll explain his conditions. We firmly believe managing chronic conditions is a collaborative effort. We see ourselves as partners with Muslim and Sami and with you, his family. So it's listened to the prompt and has generated it. And our goal is to optimize his health, manage conditions effectively, and improve quality of life. This is a massive, massive time saver. And we have some examples for you that we see our doctors using. So all the patient information that gets used with AI is anonymized. So really, these are just the prompts that we see from the doctor. And it'll just give you an idea of where this power can be because you will recognize some of these requests. So, concession letter to arrive late for work or examination due to condition. Please write a medical report summary that shows the patient is healthy and fit for work. This is an interesting one, and this is a legitimate letter. Please write a letter to the magistrate. This patient is experiencing a lot of emotional distress and requires a delay in proceedings until 2026. I will just I will take one of these. So let's say letter to the US custom officials explaining chronic conditions. And I will put that in for Pravesh as a custom letter. I will change it to his chronic conditions. It'll now go through the file, look at what medicines Pravesh is taking, list it out. Here you go, it's already up. Let me just show it. Says diabetic type 2, metformin, hypertension, the astravastin for his hyperlipidemia. So all listed medications prescribed for legitimate medical purposes and necessary for Mr. Munsami to maintain his health while traveling. It's massive, massive help and time save. Helene, are there any others you've seen that are worth me showing in terms of the custom
Uh,
prompts?
I just want to add on that. So you would have seen
Mhm.
there's an option that says copy to letterhead. So within the system, you have the option to set up and customize report headers, your signature, etc. So where it used to take you minutes or multiple minutes to go and type this out and copy and paste it, the prompt is already there, and you can go copy to letterhead. It's ready for you to go email or print, give it to the patient, and they are set to go. Um, yeah, it works wonderfully.
Awesome. Yeah, 100%. And we've created the custom ones out the box. This is really by request for the doctors we work with. So, visit summary, medical history summary, motivation letter, referral letter. I think Pravesh is a really good file for referral letter. You don't have to write an instruction. You can leave it blank and just say generate. If it's for a specific, let's say you want to go to the dietitian or refer to the dietitian, you can put in kind of what the prompt is. You'll see here. There's a few, refer to dietitian for supplementation. Um, that's an example. There's other referral ones here. But really you can just take one of our out the box ones and it'll write a referral letter. In this case, Pravesh has a lot of conditions that are relevant. And if you don't want to put in the well, let me take you through it quickly. There's the key clinical findings. It's got all the pathology findings, chronic medical history, current medications, previous medications, physical exam findings. If this is too much, put it in the prompt. Please do not include past medicines. Please do not include vitals and metrics or allergies, whatever it might be. And it takes your prompt and creates the letter, as you say.
I think also very importantly, if you, for example, do your medical insurance claims where they want you to only give feedback on the patient's back condition for the last 2 years, it will still
Hmm.
go and look at the entire file. But if you say from this date to this date, it will
Yes.
only bring back that information. Or we've had some providers that says, but I want to give information to the employer, but I want to keep the sensitive information about certain conditions because of that's within the patient's right, without excluded of this letter, and
Hmm.
you can add it to the prompt, and it will adhere to the request.
Great. Great. That's awesome. The Some things to look out for, just whether you're looking at a Healthbridge AI product or other products on the market, there are some really nice ones that we've seen and acknowledge. You want one that can be embedded in the EMR. You don't want to be having to pass information because it's very difficult to give all the context required. If, for example, if you have a pediatric, if so you have a baby that you're treating, so we have Sammy Smith, all of this information to pass to an external product, height, weight, vaccination schedule, developmental screening. This, it's very difficult if a AI tool is separate. You want to look for something that's embedded, and you want to look for something that can absorb all the information from pathology tests to we even have questionnaires. So, for example, the Hamilton Anxiety Rating Scale, or it could be PHQ-9, whatever it might be. We have these already in the system. So you don't want to be having to try pass this type of information through to an AI. You want it embedded in the EMR. Please look out for that. And the other thing to look out for is just ask questions around privacy. We have a question around Poppy. We don't pass the patient's identifiable information through, but we do work with, just said, we work with Google. We're a preferred partner with Google. So we've partnered with kind of the industry leader in terms of protection, security. It's not something we want to build. We're relying on our partner, and it's it comes obviously at a cost, but we're willing to pay because it's really important. We have a few other questions coming through. When I respond to confirm a bad transcription, is it stored in the patient clinical notes? Can that be changed to hide a bad translation? That's a very good question. You can edit any transcription before it's saved. So if you're in a consultation and you're using the AI scribe and it's populated it'll populate here as your clinical notes. I'm not going to do the scribe. I'll just say patient complains of sore throat and it says something that you're not happy with. You simply can go edit and change it. If you don't pick it up at the time, the clinical notes are immutable. We don't allow for deletion or changing or editing it, but you can always add a note to it. So you can add a note saying that um, AI scribe missed key point. Patient is not responding to whatever it might be. Let me fix my spelling. Antibiotics, and you can save that. Okay, we went really quickly. Just to recap, one, we have AI embedded into the pathology results. It'll interpret the results. It'll help you write a message, and it'll also give you a history of previous results. So there's that continuity, and you can understand why the AI is making the suggestions it's making and why it's writing what it is writing. So, for example, you want to see the history of fasting glucose, it'll be available down the left-hand side. On the file itself, or the patient's record, we have the assistant with predefined documents you can use. And we also have the clinical insights where you can ask any question. Think of it as Gemini or ChatGPT or whatever it is, and it's to do with Claire's file specifically, and it'll go through the full history and answer your questions. The messages, we had a question around the WhatsApp. How do you get back to um, respond or see them because it's a business WhatsApp? We do have a WhatsApp. Oh, I don't have it on this account, do we? No. We have a WhatsApp admin center where you can see messages and responses. I see other questions. Pricing, we can share the pricing. Pricing actually depends on how many users and the size of your practice, so we'll send that through. Can Nora do scripts and medical certificates? Nora doesn't do it. Great question on the scripts. I'll quickly show you. Um, we actually have a form of AI for scripting as well, which I'm glad this question was asked. I will put in a medicine such as Augmentin. When I select that, it's not just going to return Augmentin. It'll show Augmentin, but it'll also show AmmoClan. It'll show relative price. It'll show if it's on the formulary. If I select this, it'll have the AI would have learned the different dosages used for different medicines. So Augmentin BD, it's going to be 1 tablet twice a day. And you can see it's all populated there. You can review it and add it to your prescription. Let's go with Montair. And if I choose Montair, 1 tablet once a day, let's actually go with, let's do a Panado syrup. You'll see I didn't have to write the whole term. We'll do Panado pediatric syrup. When I select it, it's got again, the AI has learned the different dosages. You can say 10 mils, 5 days, no repeats, allow for substitutes, add to prescription, scroll down, and send it directly into Dischem's backend. So the patient can walk into Dischem and receive it. And that includes up to Schedule 6 because it is a direct integration to Dischem. And there was a question around Nora medical certificates. You can ask the AI to do a medical certificate if you want. Okay, I
Yeah,
think
we do have
mm,
the standard medical certificate as well, because if you just want a start and an end date, um it's you click two buttons and you generate. You can use AI, but you can
yeah,
also just use two clicks to generate.
yeah, absolutely. Uh, Documents. And do you have software where patients can place online orders for repeat prescriptions? Oh, I love this question because and Lillian's smiling, we're busy building this. So, oh, is my connection? Okay, there, yeah, we're busy
Can
building this
hear.
through WhatsApp currently, where patients can put in a request, you can review it, generate the script, and send it directly to them or send it directly to a pharmacy. Yeah, the last minute, I'm trying to go through as many questions as possible. The present font size in A5 can be too small, according to pharmacists. Can that be increased? Signatures also not yet saved. Okay, so Doctor, it sounds like you are a client of ours, so we can reach out to you. You can definitely save a different signature on the profile. It's just a setup thing. Font size in A5 scripts can be too small. You can do Okay. Um, all right. Um, that is the top of the hour. We will send a recording out for this. We will also, oh gosh, there's so many questions coming in. I wish we had more time. We will send a recording out. Someone will follow up with you if you want to speak to one of our consultants or have further questions, comments, suggestions. We are all ears. As I mentioned, we already work with a group of 50 GPs to help design this and create an awesome solution. Thank you again for spending your evening and time with us. We really appreciate it, and I hope the excitement of what we're building has come through. Um, and that's it. That's a wrap, Helene.
Yeah. That's right. So I did see there's one or two questions that came through for clients that asking about the package, etc. We will tomorrow send out emails and we will have links and emails there so that we can have follow-ups. We definitely want to chat to you guys and potentially see you as clients. But thank you very much for your time. This was a wonderful session. Thank you, Jared.
Thank you. Cheers, everyone.